So we have been on quite the wild weather ride, from rain and clouds, wind, snow, right, to highs in the 70s. Hey, it's Texas, we're riding the wave, right? But for some of you, winter weather can really strain your heart. Joining me this morning to talk more about the effects of cold weather on your heart, cardiologist Aaron Horne from Medical City. Dr. Horne, thank you so much for joining us today.
Thank you.
So help us to make this connection. When it's cold outside, what is happening with your heart?
Absolutely. So, when the temperature is colder, your heart is working harder. What happens is your heart rate increases, which therefore then causes the blood pressure to increase. And we know that the arterial and the venous system actually work in concert with one another. And while it can be a little bit counterintuitive, when the heart is actually working harder and the blood vessels are constricting more, that could then cause a return back to the heart from the veins to be a little bit more slow and to increase the risk of clot. And so it's really important that we're cognizant, and especially in particular demographics, our older patients need to really be cognizant when we're at temperatures of less than 40 degrees about how we manage our interaction with the outside.
So you sort of started to answer this question. I was wondering, we're from Texas here, so what's considered cold? You said less than 40 degrees. Is that sort of general, or is that considering humidity? And then you mentioned elderly folks need to be, cognizant of this. What age ranges or groups are you talking about there?
Absolutely. Thank you. So definitely the temperature being cold varies per patient population. So, we have certain well-trained athletes that are, within the 30 to 50-year-old range that have become accustomed to, their body has been accustomed to exercising in colder temperatures. But when we're looking at a demographic of patients older than 65 years of age, it's really important that 40 is the cutoff that I would say. However, like you said, when you have a windshield factor, that has to be taken into consideration. Also, being very cognizant if it's raining, all of those things are going to potentially cause increased stressors on the heart and, increase your likelihood of having a heart event, which we know are more common, especially in our patient populations that not only are older, but have preconditions and other abnormalities that might increase their event rate of a coronary event rate.
Sure. And there are folks, Dr. Horne, out there who are training for the BMW Dallas Marathon, which was rescheduled from when it usually is in December, but it's coming up. And they say, well, Sonia, I like to run in cooler temperatures because we here, especially in Texas, are so worried all the time about overheating when we exercise outside. So what's ideal?
Yeah, so, a lot of these athletes have been training for a long period of time and they know their bodies. And, one of the main things I don't want to discourage is for people to become couch potatoes during all of this, right? Because inactivity is going to then increase our risk of coronary events as well. However, we definitely want to try to exercise when the temperature is a little bit above 40 if possible. And that would be my recommendation.
Okay. And I also worry about the homeless population, including, people who are elderly, or maybe there are people who don't have proper heating in their homes. What types of cardiovascular risks do these populations face?
It's very interesting that you asked this question today. I had a patient in the office just this morning who had just succumbed to some of the ailments that came from carbon monoxide poisoning. Luckily, she was able to recover. However, that patient had a gas leak. And what we find is that sometimes when people are cold and have housing, they would open up their ovens and then be at risk to CO2 intoxication. So please be very cognizant about making sure that you're practicing safe ways in which to stay warm. I'm very concerned about our homeless patient population. We know that not only is it their heart conditions that are at risk, but they're at risk for having frostbite, and not to mention obviously the dangers that go along with being homeless. So this isn't a cardiac recommendation, but I think that it would behoove all of us to try to be cognizant of our homeless patient population. And if we can potentially donate more in terms of socks and in particular and shoes and coats, that would be very important, because these temperatures are going to be very deleterious, and I hope that we could do whatever we can to advocate for them.
Yeah, certainly a time to be compassionate. Dr. Horne, thank you so much for your time and insight. This is great information.
Thank you for having me.